Hello, I'm Dr. Ellison. If you're a man over 50 or even over 60 and you masturbate, I want to have a candid conversation with you. This topic is personal, but it's also important. There's so much silence and confusion around masturbation as we age. Some of it driven by outdated myths and some by a lack of trustworthy guidance. So today I want to change that. We're going to have a clear, respectful, and science-backed talk about masturbation in older men, what it does to your body, your mind, and your long-term health. I'll walk you through 10 potential health benefits you might not know about, and then I'll also explain 10 risks that you absolutely should keep in mind. Let's start with the good news first. Number 1, it helps maintain penile health. Every time you achieve an erection, blood flows into the spongy tissues of your penis, the corpora cavernosa. This process isn't just about pleasure. It's therapeutic. It keeps those tissues elastic and responsive. Think of it like a form of physical therapy for your sexual health. Number 2, it supports your prostate. Research, including studies from Harvard, has linked frequent ejaculation with a lower risk of prostate cancer. The idea is simple. Regular release helps flush out harmful substances from the prostate ducts, reducing stagnation and inflammation. 3, it strengthens your pelvic floor. During orgasm, key pelvic muscles contract, especially the pubic oxygus muscle. This improves erectile strength, bladder control, and can help delay ejaculation, all important areas of function as we age. 4, it lowers cortisol, the stress hormone. We live in a world that doesn't slow down, but orgasm gives your body a powerful reset by reducing cortisol. Lower cortisol means better blood pressure, better mood, and even better sleep. 5, it boosts feel-good chemicals. When you climax, your brain releases dopamine and oxytocin. These chemicals are natural mood boosters. They ease anxiety, increase relaxation, and support emotional health. Penile changes or signs of fibrosis, things that could otherwise be missed. 6, it encourages body awareness. Regular self-touch helps you stay familiar with your body. That means you're more likely to catch early signs of testicular lumps. 7, it helps you sleep better. Post-orgasm, your body releases prolactin and oxytocin. 8, it enhances circulation in the entire pelvic area. This isn't just about your penis, both of which create a sedative effect. 9, it helps with ejaculatory control. For many older men who struggle with falling or staying asleep, this can be a helpful natural tool. Healthy blood flow supports your bladder, prostate, and surrounding muscles. Better circulation means lower risk of stagnation, inflammation, and pain. If you're struggling with finishing too quickly during intimacy, masturbation can be used as a training method. Practicing techniques like the stop-start method gives you more control and confidence. 10, it keeps your desire and brain pathways active. Sexual desire doesn't start in the body. It starts in the brain. Regular self-pleasure keeps the neural pathways of arousal active and responsive, even if you're not currently sexually active with a partner. So clearly, masturbation isn't just about pleasure. It can actually play a role in your physical and mental wellness as you get older. But like anything, balance matters. There are real risks to be aware of, and they're just as important as the benefits. Let's talk about them now. Risk number 1, social isolation. Masturbation becomes a problem when it replaces real connection. If you find yourself pulling away from relationships and using self-pleasure as a substitute, it's time to reassess. Risk 3, desensitization. Risk number 2, skin irritation and micro tears. When done too aggressively or without lubrication, masturbation can cause tiny skin tears. These can lead to inflammation, irritation, or even infection. Solution: be gentle and use a water-based lubricant. If you always stimulate yourself in the same exact way, Your brain can get used to only that pattern. This makes it harder to feel aroused during partner intimacy. The fix is to vary your technique, pressure, and timing. Risk number 4. Hiding a deeper problem. Some men notice they can perform solo but struggle with a partner. Don't ignore this. It could signal underlying conditions like heart disease, diabetes, or hormonal imbalance. If this happens consistently, please talk to your doctor. Risk number 5. Nerve compression from posture. Masturbating in a hard chair or slouched position can compress the pudendal nerve, causing numbness or pelvic pain over time. The healthier option: lie back with support and stay relaxed. Risk number 6. Emotional dependency. If you're turning to masturbation every time you feel stressed, bored, or frustrated, it may become an unhealthy coping tool. Make sure you're also moving your body, talking to people, and finding other ways to cope. Risk number 7. Guilt or shame. Many men were raised with religious or cultural beliefs that make them feel ashamed about this. If those feelings linger and affect your self-worth, speaking to a sex-positive counselor can be life-changing. Risk number 8. Pelvic congestion. Just as too little ejaculation can increase risk, too much can cause discomfort, aching in the testicles or pelvic area. If you're doing it multiple times daily and feeling sore, scale back. Your body will thank you. Risk no. 9. Semen quality. Now I'd love to hear from you. What stood out the most today? If you're trying to conceive, masturbation doesn't harm fertility in the long term, but frequent ejaculation can temporarily lower sperm count. If you and your partner are trying to conceive, 2 to 5 days of abstinence is ideal. Risk number 10. Porn-related disconnection. If all your stimulation comes from extreme pornography, it can distort your expectations and harm intimacy. The solution? Use imagination or real-life memories more often and limit content that feels unrealistic or excessive. So what's the bottom line? Masturbation after 60 isn't good or bad. It's simply a tool, and like any tool, how you use it makes all the difference. When practiced with awareness, moderation, and care, it can support your health, your mood, and even your relationships. I hope this conversation gave you the clarity you were looking for. Drop your thoughts in the comments below and let's continue this important conversation together. And if you found this helpful, please hit that like button and subscribe to Men Health 101 for more respectful, research-based advice for men over 40. Until next time, I'm Dr. Grace Ellison. Stay healthy, stay strong, and I'll see you in the next video.